Hi, my name's Elzanne, physiotherapist at Recharge Physio. Today we're going to discuss a very interesting topic, how important it is to have good stability centrally to your body to enable you to have good mobility in your knee. Now we have Paul here today. Paul sustained a twisting knee injury where he irritated the inside part of his cartilage. And he also showed some weakness of the muscles surrounding his knee. We also noticed that he has some weakness in his hip, which is exactly what we're going to work on today. Now, if you look behind me on the diagram, Paul, I'm just going to show you the muscles that are affected at the moment. So you have your VMO muscle here that shows signs of weakness. And then also, if you look here, your hip muscle, your hip stability muscle, your glute medius, also shows some sign of weakness. And we're going to rehab that specifically for you. So Paul, you might ask, why are we strengthening your hip if your injury is actually around your knee? We have a muscle over here, which is your hip stabilizer, your glute medius, which shows some signs of weakness. Now, if you have weakness here, what might happen is if you're lunging forward on this leg, you can draw your leg in, increasing the pressure on that inside part of the knee, which is where your pain is. What we would like to do is strengthen this so that we can have good alignment. So when you lunge forward, that you have good alignment, decreasing the pressure on that inside part. So to do that, I would like you to come and lie down on your side. Good. Now, first off, I just want to see, can you lift your leg up? Good. Okay, so what you're doing now is you're not really switching on the right muscle. So what I would like you to do is just rotate forward slightly like that. Good, and then I would like you to lift up your knee, perfect, and hold it there for 5, 4, 3, 2, 1, and back down. And can you lift up again? Hold for 5, 4, 3, 2, 1, and back down. So this is a great exercise that you can do to help strengthening that muscle. Another good exercise to do is a glute bridge. So can I ask you to bring both knees up? Yep, there we go. And I would like you to focus to roll your pelvis so that you flatten your back and then lift up your glutes. Good. We don't want you to use your back muscles when you're doing it. We want you to only isolate your glute muscles. Good, and bring it back down and back up again. Good, and down. You don't feel any pain in your lower back? Good, so we want to isolate that one muscle group to strengthen your glute muscle. So we can also progress this exercise while you're lying down on your back by doing a single leg bridge, just to make it a bit more of an intermediate exercise for you. So if you bring this leg up for me, good. So we're putting most of the pressure through this leg and then lift up your glutes. Good, and back down. Perfect. So we've worked on some hip strengthening now. Now we're going to focus a bit more on that knee stabilizer strength. So we're going to do an inner range lunge, working on the inner part of your knee. Okay. So I would like you to come forward into a lunge and then straight your knee. Focus on contracting your muscle. We're going to go forward into a lunge again and then straight your knee, contracting your muscle. Good. Progression is also really important, so we're going to progress Paul now doing an overhead lunge, getting him to do a bit more of a functional exercise. So Paul, can you please bring that one leg forward? Good. I would like you to bring the kettlebells overhead. Good. I'm going to just stabilize your knee and I want you to go into a lunge. Good. Not deeper than that, and back up. Good. Come on down again. And back up. Well done. So it's really important to remember that the whole body is interconnected and we need to focus on not only treating the injury site but the whole system and making sure the whole system is working properly.
That's better.